They can look like if this can look like if you're speeding in and out of the room, it can look like they're very comfortable. It can be kind of interesting. These patients can look very comfortable. They could be sitting chilled out. Sometimes chilling out is their way of dealing with and disconnecting from what's happening. Now, it is normal, by the way, for a normal birth to have memory loss. But it's the difference here is that it's not in alignment. It's not like they're in the zone. They're really disassociating. They're breaking from themselves, from their body. Some disassociation, they don't even respond by name. So it's important to keep that in mind. Also, just briefly, we know about some of these other responses that can be coupled with a hypervigilant and a disassociated response is the 5 F's: fight, flight, freeze, faint, and fawn. Quickly, fight and flight. In the birthing room, a patient may avoid eye contact. They may disengage from conversations. They may seem emotionally distant. They may disassociate. They may appear checked out. Fight and flight responses. Sometimes they may argue, fight. They may disengage, flight. Behaviors can be misinterpreted as these are just a difficult person in there. They're non-compliant, rather than being understood as a trauma response. Okay, faint, freeze, and fawn. I think for those three, they are freeze. They appear quiet, really cooperative, but internally, they're very overwhelmed. A patient may fawn. They might seem to be the perfect patient. They go along with everything. But what you'll find is that later on, they may express some unresolved feelings from the birth experience. These patients are often seen as doing great. But during labor, only for the providers, you guys, to be really surprised that later on they're having these feelings of fear, regret, and trauma. And I can go into it, but I won't necessarily. But fawning is a protective factor because many times if you feel like you're in a place that's unsafe, let me be nice to this person so they can leave me alone and not put me in a place of danger. So fawn is a little hard because you feel good about yourself. They want to please you, you know. Keep that in mind. Okay, so I have a case. Um, let's see what's happening. A hypervigilant
Okay.
case. Uh-huh.
Hold on, lady.
Okay, so we got Tamika here. During labor, she appears extremely tense, on guard. She's continuously asking the staff what's happening, insisting on every detail, every procedure before it happens. She becomes visibly distressed when providers are entering the room unannounced or touching her without explicit consent. When a cervical check is suggested, she starts shaking, gripping the bed rails, refusing the exam. As contractions intensify, she can become overwhelmed, beginning to hyperventilate, expressing fear that she is losing control. We see what it looks like. Tamika is tense. She's on guard. She wants to know everything. This hypervigilance is a hallmark of trauma. Her brain is scanning for threats. She's interpreting ambiguity as a lack of control, not in control. That's dangerous. Her nervous system is trying to find a way to maintain some safety about what's going on with her. Cervical checks could be highly triggering.
John Fields, Randall Bennett's associate. Randall's right behind. He should be here any moment.
Oh, very good.
Okay, great.
I don't know how to mute.
You're listening here?
Anyway, so all of these things are happening. Labor is an intense physical and emotional experience. Yes. Someone with a trauma history, the combination of physical sensations, pain, all of that perceived loss of control can overwhelm the nervous system, panic, fear of losing control. We all see this here with her survival mechanisms.